November is Epilepsy Awareness Month. Many people with this disorder deal with the worry of not knowing when a seizure might strike. Here to tell us more is Dr. Schuyler, epileptologist with Hartford Healthcare. It's great to have you, Dr. Schuyler.
Thanks so much for having me.
We were talking earlier, I mean, millions of Americans have epilepsy, but when it happens, it really strikes them, takes them off guard.
Absolutely. You know, there are so many people actually in our country that have epilepsy. It's estimated that 60,000 people in Connecticut alone suffer from unprovoked seizures, which is how we define epilepsy.
Yes, and so what happens when you're having that seizure?
Well, you know, seizures can take many forms. Some people, when they have a seizure, they have what we call a convulsion, which is what most people think of when they think of a seizure. If somebody collapses unconscious and they shake and have a convulsion. But there are other types too that can still impair consciousness. Some people stare off. Some people have unusual behaviors, experience funny things, and sometimes it can be hard to tell if what somebody's having is actually related to epilepsy or not.
Exactly. So oftentimes I would think that it would be misdiagnosed or not diagnosed at all.
You know, sometimes it's really hard to tell, and that's why it's really important to see a specialist, to see a neurologist, especially somebody who specializes in epilepsy. We know the right questions to ask, both of the patients as well as the people who are witnessing what's going on with them, their family members, their friends, to really try to figure out what's going on. And then we have tests that we can do, for example, an EEG test to record the events and find out if, you know, and make a clarification in terms of what their diagnosis is.
Basically, what is going on in your body when this occurs? So
when somebody has epilepsy, their brain is prone to having unprovoked seizures, which means that at any time, sort of unpredictably, their brain, the neurons in the brain can fire abnormally, and those abnormal discharges in the brain are what lead to the clinical symptoms, either of losing consciousness, experiencing some abnormal neurological symptoms, or collapsing.
And the blackout could last how long?
Typically, a seizure will last between 1 and 2 minutes.
Oh, it can be that long?
Yeah. If a convulsive seizure lasts more than 5 minutes, that's really a serious medical emergency. But most of them, fortunately, do end after about 60 to 90 seconds or so.
Are you more at risk for this if you have a family history?
You know, there are a lot of different risk factors for developing epilepsy. Some types of epilepsy have genetic components, and so in that case, a family history would be relevant. In other cases, somebody can develop epilepsy due to an injury to their brain, such as a head injury, a stroke, a brain tumor, or anything else that really could damage the brain.
So that could trigger it.
And make it prone to triggering a seizure.
Treatment. I know there's a lot of treatment out there.
Yeah.
What can people expect once they're diagnosed?
The first line after we make the diagnosis of epilepsy, and that's by using imaging and EEG, we use medications as our first line. And at this point, there are a lot of medications out there. About 2 out of 3 patients with epilepsy respond really well to the medications. And it's just a matter of finding the one that works and the one that doesn't cause side effects. However, about 1 in 3 patients, the medications really are not effective in completely controlling the seizures. And that's what we're really looking to do, is to stop the seizures altogether.
Very good. And I know that there are some things that actually can stimulate the brain or stop the seizure from happening.
So in some cases, we can actually cure epilepsy altogether with a surgery. So if it's the type of epilepsy where there's a tiny spot that's really acting up, in some cases that spot can be surgically removed, sometimes with minimally invasive techniques or laser ablation, and that person can go on to be completely cured. In other cases, if there's not that spot where you can remove, there are other devices, for example, the vagus nerve stimulator, which is sort of like a pacemaker. It's a same-day procedure. It's not a brain surgery. It's a device that's placed, and that device can help reduce the frequency and severity of seizures.
Dr. Schuyler, thanks so much. So much great information there.
Yeah, thank you for having me.
You are welcome. Right now we